Everyone, sorry for the halo of light here. It's earlier than I usually do this, so it's a little brighter than usual. So I apologize, but we'll ignore that and move on. COVID-19 is really the only story right now. Closures, people at the airport, Canada Border Services agent officer at Toronto Pearson Airport has tested positive, and the other assorted impacts. Alberta schools are closed, looks like till September. If you are in grade 12, then you will likely graduate, says Jason Kenney, but he says that's how I understood it. A couple of other people said maybe it's not, maybe it's, we'll see. I don't know. But lots is going on. We'll start with this. The other part to this is I want to tell you, you've heard this flatten the curve, right? You've seen the big curve and then the little curve. I'm going to show you an infographic about that. This thing, that flatten the curve idea started March 11th. March 11th. We're March 16th right now. So that's the plan. The plan is you're going to get this. Plan to get this later in summer and not right now, because if you get it right now, we're pretty sure that our hospitals will be overwhelmed just like Italy. They didn't plan. They had 2 months. They had a lot of time to plan. It's not like this was not going to happen. It's not like Canada's special for whatever reason. We watched this happen in Wuhan. We watched this happen in Italy. We watched this happen in Singapore and South Korea. And we are now continuing to allow flights to land. Even today, flights are landing in Toronto and Vancouver and Montreal and Calgary because Justin Trudeau's rerouting those flights. He's not stopping flights. This is 17 minutes ago. A friend of mine just sent me this clip. CP24 is reporting CTV News has learned that Prime Minister Justin Trudeau will announce that some international flights will be rerouted to Montreal, Toronto, Calgary, or Vancouver amid the COVID-19 outbreak. Right, so just like concentrate the outbreak in major cities, and that way we'll replicate Wuhan 4 times, Montreal, Toronto, Calgary, and Vancouver. Is that the idea? Yeah, right? We'll just put all the infected people there. And forget about screening. Who needs screening, right? But first, let's look at Dr. Cbsa Tam. She is the Chief Public Health Officer of Canada, okay? And well, let's just go back in time a little bit. Do you remember January 29th? Oh, those were the days when you were watching videos of airplanes with Chinese people with heat guns or temperature guns pointing at everybody's forehead going through, right? Oh, you're okay, you're okay, you're okay. Don't get off the flight. I thought, oh, this looks serious. This looks like, those panels in graphic artists' comic books where the talking heads are talking on the TV to set up the dystopian world that you're about to read about, right? Like that's what that felt like back then. And this is Canada's top priority 2 months ago when they could have been planning, but instead they were shaming us about racism. Here's Dr. Cbsa Tam. I'll say again, the Chief Public Health Officer of Canada. On January 29th, she says, quote, "I'm concerned about the growing number of reports of racism and stigmatizing comments on social media directed to people of Chinese and Asian descent related to the 2019 COVID coronavirus. End the stigma. Hashtag end stigma." And it says, "Help stop the spread of biases with these handy virus-looking things floating around here." It's just offensive. It's just offensive. Miss Tam, yeah, well, I mean, I hope that you suffer the consequences of your inaction, madam. Really, racism is the most important thing? Help stop the spread of viruses. Don't forget washing your hands. Forget that. Forget public distancing. Forget all that. Don't make assumptions about people or use stereotypes. Be careful of the language you use. Go to trusted and verified information sources. Don't call it the Wuhan virus. It's COVID-19. 2.5. It's understandable that our fears increase during times like this. However, we need to remember that cohesion in our collective efforts is important. Everyone has a part to play in preventing the spread of the virus. The Chinese community and all travelers from affected areas are a key part of these efforts. Really? How? Number 4. We need to learn from our experience with SARS, where Southeast Asians faced significant racism and discrimination. I think there were a lot of lessons that were ignored from SARS. A lot of them have to do with containment and figuring out how to stop this thing. Way back in January when you knew it was happening, and instead of focusing on stopping it, you focused on shaming Canadians about racism. 5 of 5. Racism, discrimination, and stigmatizing language are unacceptable and very hurtful. These actions create a divide of us versus them. Canada is a country built on deep-rooted values of respect, diversity, and inclusion. I remember a time when being told that Canada was built on hard work and seized opportunity. Right? Respect, diversity, and inclusion. Can you plow this field? No? Okay, go make lunch. Like, what's the It's so frustrating because it's so dumb. It rewrites history in a way that minimizes all of the hard work and toil that everyone did, not just men, not just women, everyone, even children. It was difficult to create what was created in the West. It is difficult to maintain it. And in the face of that, in the face of a threat to that, they're saying, don't be racist. Remember, we were built on respect and diversity and inclusion. Shove it up your... Seriously. Fast forward to February 22nd, they still don't have a plan, everyone. They realize there's a problem. At this point, they realize there's a problem, but they still don't have a plan, and they won't have a plan until March 11th. And the plan is you're going to get this. Pray you get it later so the hospitals can maybe take care of you. And pay no attention to the fact that our hospitals are already declaring states of emergency. Brampton Hospital declared a state of emergency January 22nd because 700,000 people are served by one hospital in Brampton. One. They knew in January. They ignored it. They knew in February. They ignored it. One of three from Dr. Tam, the Chief Public Health Officer of Canada. She says, quote, COVID-19 is a serious public health issue and there is a possibility that the virus is present in countries that may not have the capacity to detect or contain the virus. Like Canada? 2, Government of Canada is working collectively with our partners at all levels of government and with organizations at home and abroad to respond to COVID-19, as well as to plan and prepare should the situation escalate. 3, it is prudent to ramp up our planning and preparations in the case of a more widespread outbreak of COVID-19. The risk to Canadians has not changed at this stage, but we must plan for all possible scenarios. Fast forward to March 11th, and I'm going to show you, this is the first mention of flatten the curve from our public health officials, right? From Dr. Tam, from the public health officer, okay? Number 1 of 5. And you would think that they would have something. You would think that they would look at Wuhan, that they would look at Italy, that they would look at Singapore and South Korea and say, they're doing this right, they're doing this wrong. Wouldn't you? I was doing that and I'm in my garage, like I'm literally in my garage. I don't know what they're possibly doing. What are you spending your time on? Anyway, okay, back to this. In March 11th, they've come up with a plan, and the plan is you're going to get this. Just pray you get it later. COVID-19 outbreak control measures can slow spread, reduce peak impact on health systems, and give hospitals time to prepare, manage surge. It will take everyone working together to hashtag flatten the curve. Show this thread, so we'll look at the thread here. There's a couple. 2 of 5. Here's what we all need to do to flatten the curve of COVID-19. Good hygiene practices, frequent hand washing, coughing etiquette, elbow sneezes, social distancing, stay home if sick. If sick, call ahead to be guided to appropriate care. I'll mention, this is airborne, so the hand washing is suspect, and staying home if sick is great, except that this spreads when you're asymptomatic, despite what Justin Trudeau says. The WHO has acknowledged that. I've showed that a bunch of times on here. If you want to look at one of my other shows from yesterday or the day before, I've linked that a bunch of times. It spreads when you're asymptomatic. It spreads when you're not sick yet. And if you start to get a little sore throat, you're symptomatic and you're shedding virus. And not many people are going to be like, oh man, I've got COVID, I'm going to stay home. Most people would know their boss is like, oh man, everything's going crazy. Get in here, right? We need all hands on deck to solve this COVID-19 thing. Get in here. I've worked in offices, I've worked in schools. That's how it works, right? So this idea, stay home if sick. I've got a cough and a friend from Wuhan. Call in sick. It's unbelievable how many people in this context work through this. Anyway, and the advice is just is poor because it doesn't take into account the fact that this spreads asymptomatically, this spreads before you're showing symptoms, and all of the rest of it, elbow sneezes. It's if you breathe and then walk into somebody burps and you're like, oh man, that was tuna fishy. You could have inhaled the virus there. That's how airborne this is, right? And it's not so airborne that if you're talking, as far as I understand it, that if you're talking in your office, it could fly down the hall. But maybe, because we've got HVAC systems that take the air from your office and recirculate it all through, right? So there's a lot wrong with what's being told to Canadians as gospel, as the real truth, right? And they say, be wary of misinformation. Be wary of the Canadian government's misinformation. Know what you're talking about. The WHO has been saying this is not a drill. I think I titled one of my videos, This is not a drill. Anyway, back to this, flattening the curve. By protecting those who are at high risk of severe outcomes, including older adults, those with weakened immune systems, or with underlying medical conditions. Protect yourself, protect others. I've heard that the median age in Italy is 66. That means there's many patients above 60, the age of 66 is below. I've heard there are 20, 30, 40-year-olds in the ICU in Italy. So again, this is not the same information that I've been hearing from credible sources out of Italy, out of South Korea, with regard to the age of patients. I've heard a lot of people saying, and a lot of doctors on Facebook, so take that with a grain of salt, but saying it doesn't matter the age of the person, comorbidities are more impactful. If you're obese, if you smoke, those things will impact more than age. So again, like they're giving you some information, but not nearly enough. And I'm not the public health official. I'm not. So it seems really strange to have half-truths and other things being told by this person. It's just frustrating. Okay, back to this. By making a plan to ensure your loved ones have what they need to stay healthy, stay home if sick, avoid public spaces, transit, stay away from those at high risk if you are sick. Okay, so again, this is a little bit muddy in my opinion. 5 of 5, social distancing and other measures that public health officials are recommending now may seem extreme, but robust action now can help avert extreme pressure on our health system across society. So on February 22nd, there was no plan. They didn't say any of these things. This is the first time, and I'll show you the Twitter. There's a couple more threads here. The measures we take. Okay, hold on. I'll show you the threads. Here's the search for the flatten the curve. Okay, so these are all the tweet threads with the flatten the curve language. And well, when you scroll all the way to the bottom, the first time it's mentioned is March 11th. Right? It's all March 11th. March 13 hours ago, March 11th. There's no history of this. This isn't a long-standing plan. This is what we do during an epidemic. They didn't make a plan in February. They didn't make a plan in January. I understand I've been diatribing about this for like 7 minutes, but my goodness, could you not see? Were you not watching? Were the governments of the world not taking seriously the fact that it looked like China bio-nuked themselves and then exported it? And the rest of the countries of the world said, air travel's fine, everybody's fine. No, look, did you see the heat guns they're using on their foreheads? So, they're taking this seriously. They're not taking this seriously. They're still not taking this seriously. Okay, here's March 13th. The measures we must take within Canada will cause disruptions in our lives, but they are vital to protect our families and save lives of those most vulnerable among us. Flatten the curve. All incoming travelers are asked to self-monitor for symptoms for 14 days after coming into Canada. Hey, I'll tell you a story. In my wife's office this past week, somebody came back and they were flying in from Mexico and they returned to work the next day. And it's incredible. Like that lax attitude led to people being exposed who didn't need to be exposed. Unbelievable. Unbelievable. And just like, how do you enforce something like that when the Canadian public doesn't take it seriously, but because you haven't been taking it seriously, right? When people come back from travel, they're not thinking that they should check this first, right? All incoming travelers. So this is not true. Like they say this is true, this is not true. And I did a whole show about this not being true yesterday. Number 3, if you're coming from Hubei province in China or from Iran or Italy, you're asked to self-isolate at home for 14 days and promptly report to your local public health authority. 404, we are also asking all travelers coming from anywhere outside of Canada to consider a 14-day self-isolation as an additional precaution. And this is the flatten the curve search. And this is 1 of 8. This is 13 hours ago. She says, there are 313 COVID cases in Canada, with 10 provinces now reporting cases. With the recent rapid rise in cases, Canada's window to flatten the curve is closing. You just told us 5 days ago. It's closing now. Oh my goodness, we've lost our opportunity because you squandered it in February and you squandered it in January because you didn't do anything. This is all on you and your failed government, Miss Tam. It's unbelievable. Canada's completed over 25,000 lab tests to cast the net wide for possible COVID cases, except that they're reducing the people that they test. COVID-19 is a serious public health threat. While this disease is particularly serious for older adults and medically vulnerable people, all ages are at risk. Well, there you go. At least that's true. Actions we can take to slow the spread and reduce impact: postpone or cancel non-essential travel, avoid large gatherings or crowds, distance 2 arm lengths from others. If needed, work from home. In particular, I'm strongly recommending that all travelers arriving in Canada take additional precautions to self-isolate for 14 days. Yeah, it's not going to do anything because people aren't listening. Older adults and those with medical conditions are at high risk for severe COVID-19. Practice social distancing and separate yourself from others whenever and wherever you can. All of us need to take every precaution to protect those at high risk of severe COVID-19 while at the same time ensuring that most vulnerable among us are fully supported and not isolated. This is our chance right here and right now. We need to act immediately and act together to flatten the curve of the COVID-19 epidemic. For the latest updates, blah, 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 blah. So again, because of inaction, because of the fact that they didn't take this seriously in January and February, and they were more worried about racism in January and having a plan but not actually following through with that. It seems like everything the Liberals do, right? Oh, they talk up having a plan, and then when it's time to have the plan and actually execute it, they got nothing. And then they come up with social distancing a few days ago and then say, oh, the window's tightening and closed. Oh no, shucks, we missed it, eh? Because I guess we didn't do our jobs 2 months ago. Dentists are closing offices tomorrow until early April. Directive from College of Surgeons. I believe that's Ontario, but I'm not 100% sure. There was a rumor going around all weekend saying Ontario was considering a full lockdown. I think that we're going to see a lockdown by another name. I think everything but grocery stores, gas stations, and pharmacies will be closed. That's what I think. I think that's where we're going. I think we're going to see Trump do that. I think it's going to start as a 2-week thing, and it'll expand until who knows. Who knows at this point? I don't know. Here's Doug Ford. He says, new legislation coming for workers required to take unpaid leave during self-isolation. So, the provincial government is trying to do something about this. Students are expected to stay home. Alberta schools, daycares to close over COVID-19 concerns. This is more in-depth. This doesn't go into how long the schools are closing, but Jason Kenney said yesterday that he thought that they would have to close until at least September to be effective. So this is unprecedented. I've never seen anything like this. This is taking up all the air. I am severely disappointed with the federal government's response. I thought that Doug Ford would act first, and I was correct. And Trudeau's measures are not even half measures. Not even. We're just funneling it to major cities, and from those major cities, people can rent cars, hire drivers, get an Uber, whatever it is, and spread the virus. And this is irresponsible. This is as irresponsible as not paying attention to what was happening in Wuhan in January and the rest of the world in February, and believing that we can land flights from infected areas and not suffer any consequences. All of these consequences could have been avoided had we acted when we knew that this was a problem. And we knew this was a problem in January, but the government's main concern was racism. That is not appropriate. They did not keep Canadians safe. They did not do their job. This person is derelict has not done their duty. Dereliction of duty, is that the correct term? I could be wrong. I'm not military, but they're not doing the job that the Canadian taxpayers are paying them to do. She was sitting around lobbing criticism at racists who just didn't want to get sick. It's incredible that this is happening in Canada. It is offensive. It is expensive. The inaction has cost us billions of dollars. It's not a small mistake. People's businesses are going to have to close because of their inaction. Airlines, the airline industry, all sorts of schools are closing. Everything is closing because of the inaction on this, because they thought that we were bulletproof. They thought that it wouldn't happen here, or they wanted it to happen here. I have no idea what the motivation is, but fundamentally, the inaction from January to now, and they still haven't acted, is inexcusable. Thanks for watching, everybody. Check out CanadaPoly.com, check out CanadaReport.co, and have a wonderful, wonderful day.